Good afternoon, everyone. Am I
Good
audible? Can you hear me?
Yes, sir.
So, dear friends, today Dr. Nidhi is busy with some patients. So, today class will be taken by me only. आज डॉक्टर निधि थोड़ा बिजी है, तो आज की क्लास मैं लूंगा पूरी आपकी. Okay. So, we are under the discussion of the motor point. हम motor point का discussion कर रहे हैं. Yesterday we started the discussion. The purpose to discuss the motor point. There are two purposes. मोटर पॉइंट डिस्कस करने के दो पर्पज हैं. पर्पज नंबर 1 that we should aware with the movements like what is flexion, what is extension, what is eversion, what is inversion. That is the primary purpose. पहला तो पर्पज ये कि हमको सारी मूवमेंट्स के नाम पता होना चाहिए. दूसरा पर्पज ये भी है फिर उन मूवमेंट को करेक्ट कैसे करना है वो भी पता होना चाहिए. और ये तो सिर्फ शुरुआत है, राइट. When we will be going through the each and every joint, like we will be going only when we discussing the shoulder joint. So even the shoulder joint is going to take too many days because we are going to discuss in each and every point in very, very detail. Each and every joints. तो हमें अपना फाउंडेशन थोड़ा स्ट्रॉन्ग बनाने की जरूरत है. So let's continue. We'll be doing quick recap what we discussed in the previous class. जो हमने पिछली क्लास में समझा था. हमने टोसिस की बात की थी और हमने कहा था कि if we want to work on the ptosis, drooping of the eyelid, so this is the point. Gallbladder 14, we already have seen the location. Gallbladder 14 हमारी आंखों के ऊपर होता है. We already see the location. This is a very good point for ptosis or the drooping of eyelid. Then we have discussed the next condition when the person is not able to close the mouth, close the jaw, not able to raise the mandible, stomach 6 point. तो हमने अगली बात की थी अगर कोई व्यक्ति अपना मुंह बंद ना कर पाए, अपने मैंडिबल को उठाकर मुंह बंद करना होता है. अब मैंडिबल को आप ना उठा पाओ, अपने जबड़े को, नीचे वाले जबड़े को ऊपर ना उठा पाओ, मुंह बंद ना कर पाओ, या आपका मुंह खुला रह जाए, तो हम स्टमक 6 का प्रयोग करते हैं. स्टमक 6 पॉइंट इज लोकेटेड ओवर दिस मसल. दिस इज द मैस्टिकेशन मसल, मैसेटर मसल. हमारे इस मैसेटर मसल पर पाया जाता है. इसको भी हम समझ चुके हैं. Then I told you if the person is not able to rotate the neck to the right and left, अगर व्यक्ति अपनी गर्दन को राइट नहीं घुमा पाता, लेफ्ट नहीं घुमा पाता, यहाँ की मसल में स्टिफनेस हो जाती है, राइट. The person is not able to rotate the neck to the right and left. Right rotational movement and the left rotational movement is difficult. CV22 is the very good point. हम CV22 के माध्यम से इस स्पाज्म को रिलीज करते हैं, मसल को रिलैक्स कर देते हैं. So we know this is the location of CV22 or called throat pit. विशुद्ध चक्र का स्थान है जहां पर हमारी गर्दन की समाप्ति पर, गले की समाप्ति पर खड्डा होता है. That is the location of CV22. It's a wonderful point, and with the help of this point we will bring the free neck movement. Then we can do the right and rotational movement. Then we have discussed pronation. Pronation मतलब डोनेशन. जब आप किसी को डोनेशन देते हैं तो आपका हाथ कैसे होता है? Pronates. So we can see when we are turning the hand downward, right? That is called pronation. If it is not possible, then heart 3 point. वैसे भी आपको प्रोनेशन करने के लिए हम हार्ट 3 पॉइंट का प्रयोग करेंगे. सो लुक एट हियर, इफ द पर्सन इज नॉट एबल टू फ्लेक्स द आर्म, not able to pronate the arm, use the heart 3 point. ये हम समझ चुके हैं, क्विकली समझाते हैं. Flex the arm, not able to do this is the flexion. Not able to do this is the pronation. Flexion means I want to flex it. Flex का मतलब होता है नजदीक ला, दो हड्डियों को आपस में पास पास लाना. So I am bringing the two bone near, that is flexion. Then pronation. Pronation means turning down or turning down. Ashirvad mudra. This is also, we can see Ashirvad mudra. You can see in this, we have done two movements. Number one movement, flexion and pronation, because this is the pronation, donation. So heart 3 point. Heart 3 point, we put the heart 3 point, then we'll be able to do this. Now remember one thing, अगर कोई पैरालिसिस का पेशेंट है और जिसका हाथ पहले से मुड़ा हुआ है, मत लगाओ उसको. Don't put the point. If some paralytic patient already hand is in the spasm condition, don't put. Many paralytic patient or many different patient having this type of arm means flexion as well as pronation. And if you put the heart 3 point, the problem will increase, because heart 3 point will be increasing the flexion and pronation. और अगर लगाना ही पड़ जाए तो हम दूसरे हाथ में लगाएंगे, हम उस हाथ में नहीं लगाएंगे जिसमें ऑलरेडी फ्लेक्शन एंड प्रोनेशन है. Right? Have you seen someone doing hand like this? So how can we put the heart 3 point? Because heart 3 point will increase this movement. Then, but for that patient, what we want? For that patient, we don't want more flexion. हम ज्यादा फ्लेक्शन और नहीं करना चाहते. अब तो हम क्या चाहते हैं कि भाई इसका हाथ खुल जाए, एक्सटेंड हो जाए और इसका हाथ सुपाइन हो जाए. That is our target. Many mental retarded kids having this condition, they might be having flaccidity in some body part. उनको हो सकता है कि किसी बॉडी पार्ट में फ्लैसिडिटी हो, यानी ढीला, लुंज, नो पावर, like neck is like this. Lunge put. But another condition that is called spasm. Spasm is very tight. We want to open the spasm, that is extension. But right now, so we are coming to our point. If the person facing difficulty to this, तो आप हार्ट 3 का प्रयोग कर सकते हैं. वैसे भी आशीर्वाद देने के लिए आपका हार्ट अच्छा होना जरूरी है ना, तभी तो आशीर्वाद निकलेगा. सो अगर आपका हार्ट अच्छा है, नहीं है तो लगा दो हार्ट 3, हार्ट अच्छा हो जाएगा और आशीर्वाद निकलना चालू हो जाएगा और यह डोनेशन देना चालू हो जाएगा. ओके, सो हार्ट 3 is the very good point in the corner. We put the point, the ulnar nerve passing from there. Ulnar nerve is coming, crossing the entire forearm, even it's going to the small finger. So when we do this, person is able to turn the hand downward. So look at this image once again. एक बार फिर से image देखिए. So we can see when we turn the palm downward, this is called pronation. Heart 3 will improve the pronation. Let's move ahead. Look at here. This is the flexion. We can see flexion. तो जब हम दोनों हड्डियों को पास पास लाते हैं इसे फ्लेक्शन कहते हैं, और हार्ट थ्री के माध्यम से हम फ्लेक्शन को इंप्रूव कर सकते हैं। पिछली क्लास में ऑलरेडी हम इसकी लोकेशन देख चुके हैं, तो वापस अभी हम नहीं देख रहे हैं। We have seen already this location. We have seen the demonstration, right? Now we are moving to the next point. Very, very important point. LI10, large intestine 10, right? So large intestine 10 is the very good point who increase power. लार्ज इंटेस्टाइन 10 एक हमारे शरीर का वो बिंदु है जो पावर बढ़ाता है, right? Like we see in the leg we have stomach 36. In the same way in the arm we have LI10. Yesterday I already told you, when you are putting the LI10 point here, from the elbow crease, we are going to chun, distal. From the elbow crease, I am going to chun distal. That is the location of LI10. Radial nerve is passing from there. So it's pulling the hand to the back side, extension of the wrist. This is the power pushing, extension of the wrist, and abduction of the wrist. If you are not able to perform this, have you seen the movie Kung Fu Hustle? ऐसे करता है वो. Have you seen that? एक 20 फीट का हैंड बन जाता है, 20-30 फीट का, not 20-30, 100 फीट का हैंड बन जाता है. No. So this is the power coming. We can increase this movement over LI10. LI10 is the power point. If some person is feeling tiredness, we always stimulate LI10. LI10 is the point who gives power, energy, enthusiasm. LI10. What is the function? Extension of wrist, abduction of wrist. ये दो काम. When you want to do the extension of the wrist, you have to take the help of radial nerve coming from this side. This will do the extension, right? And abduction. So in this way, LI10 is the very good point for this purpose. हमने पिछली क्लास में देखा था LI10. So this is the LI10 extension of the wrist. We can see this is the extension. And abduction, taking away. Abduction. जब भी ab means away. Ab means away. And add means near. कहते हैं add कर दो, near ले आओ. Ab means away. Abduction, taking away. Both hands we are taking away with each other. जब दोनों हाथों को हम एक दूसरे से दूर ले जाते हैं, या किसी भी चीज को जब हम एक दूसरे से दूर ले जाते हैं, उसे abduction कहते हैं. When we are taking anything away with each other, that is abduction, right? So we understood this two movement is done by LI10. We can improve by the LI10. This is the location of LI10. From the LI11, this point is 2 chun distal. हमारे LI11 से ये 2 चुन की दूरी पर पाया जाता है, इसका नाम है LI10. Now we are moving to the next movement, supination of the arm. supination. What is supination? Supination means we are asking something. Bhikari mudra, beggar mudra. Just for understanding purpose, right? Or it's not only beggar mudra, it's you're asking something, you're asking blessings, you are keeping your hand open to receive the energies. Supination, supine, facing upward. Supine का मतलब होता है जब कोई भी चीज ऊपर की तरफ फेस करती है, the meaning of supination, facing upward. That is called supination. We can see the movement, right? So look at this movement once again. Supination is like this. My hand is in this condition. Supination means this is the supination. We are asking something. That is supination. So when anything facing upward, that is supination. जब हम लेट जाते हैं तो कहते हैं supine position, सीधे लेट जाना, supine position. So if we want to perform this movement perfectly, we are not able to perform this movement perfectly. If we want to perform this movement perfectly, and we are not able to do it, if we are not able to do this, then go here. Lock is here. यहां पर ताला है, वो ताला खोल दो, ये मूवमेंट चालू हो जाएगी. SI9 is located, we can say toward the sky, right? Perfect. आकाश की ओर. इस ताले को खोलने के लिए एक बार हम समझ लेते हैं ये ताला कहां है. So you can see in this image, I will show you one video. Yeah. SI9, the lock here, one tune up from the axillary crease. यहां से एक चुन ऊपर है. SI9, wonderful point, right? So when we are putting the point, we can see here, this is the one tune up from the axillary crease. हमारे axillary crease से कितना ऊपर है? एक चुन ऊपर है. Can you see the axillary crease? क्या दिख रही है आपको axillary crease? यहां से एक चुन ऊपर है. So this is the very good point, and this point working as per the meridian concept, because when we talk about the motor points, the many motor point will be on the muscle. That part will come shortly when we are discussing the individual muscle. But the many motor point might be distant. कुछ motor point दूर हो सकते हैं. So SI9 is the very good motor point जो आपको receiving मुद्रा में लेकर आता है. You start receiving. You start doing supination. We have to understand this condition because some patient will come to you who is not able to do this. वो ऐसे नहीं कर पा, हाथ ऐसे है. He is not able to do this. SI9 will do that, right? SI9 की help से हम कर पाएंगे. So we need to remember 2 points. One LI10 here. Another is SI9, 2 point working opposite. So now you can see in this image. SI9. In the acupuncture, maybe this image is not that much clear, but I demonstrated you. That is the perfect, right? Now we are moving to the next condition. Many patients are coming to us. They are not able to do the various different type of the shoulder movement, arm movement. कई पेशेंट हैं जो अलग अलग प्रकार की मूवमेंट नहीं कर पाते हैं, जैसे कि फ्लेक्शन का मतलब क्या है, एक्सटेंशन का मतलब क्या है, और एक्सटर्नल रोटेशन का मतलब क्या है, ये तीनों पता होना चाहिए. Some patient is not able to do flexion, right? अब देखिए, if you are already a medical student, you might be knowing it's a very easy thing. But if you are coming from the different field, you might get little confusion when we talk about the shoulder movement. अब शोल्डर मूवमेंट में हमने कहा, मैंने आपको बोला था कि फ्लेक्शन का मतलब है हड्डियों को पास ला, बोला था. अब यहां पर बात बदल गई. Look at the flexion of the arm. Flexion of the arm is this. This is the flexion, right? कि मैंने हाथ को ऊपर उठाया, ये क्या है? फ्लेक्शन. ओके, फ्लेक्शन. तो एक्सटेंशन कहाँ गया? What is the extension? So when I am doing this is the flexion. And this is the extension. Flexion. Even we are telling this is the extension. Sometimes we tell hyper extension. तो पेशेंट को हम बोलते हैं कि हाथ फ्लेक्स करो. Oh, it's paining. Some patient, okay, extension karo. Oh, it's paining. If flexion is painful, this front muscle might be responsible, anterior deltoid might be responsible. That part will be discussed in the shoulder. And there are so many muscles might be disturbed here. The grip of the muscle. अगर आपको फ्लेक्शन करने में तकलीफ होती है तो आगे की डेल्टोइड प्रभावित हो सकती है और भी कुछ अंदर की मसल प्रभावित हो सकती हैं, उनको रिलीज करना होगा. अभी एक पेशेंट को यहां दर्द था, फ्लेक्शन. वन पेशेंट वाज हैविंग प्रॉब्लम इन द फ्लेक्शन. ही वाज हैविंग पेन इन दिस मसल. In this muscle, we release this muscle. We release this muscle by the point found here, then he got relief here. Because muscle are coming here, muscle are coming here, muscle coming from all around, and the pain might be result of only single muscle spasm or the combination. Some person is having difficulty for doing the extension. किसी को extension करने में difficulty है और किसी को तीन तरह की प्रॉब्लम हो सकती है. फ्लेक्शन, एक्सटेंशन एंड lateral rotation. Lateral rotation, right? So lateral rotation, one patient is coming. Okay, when we ask, okay, do you have pain today? Okay, let me check. Let me. She's doing like this. because she is having pain only in this particular condition. So I will tell you right now, don't think it very in the complicated way. Just I want to tell you whatever the condition here, first we have to stimulate 2 points, whether the problem the flexion or the problem the extension or the problem the lateral rotation, 2 point, fixed point to release entire muscle area. Then we'll go to the specific approach later on. केवल 2 बिंदु. पहला, the first point will be whether the problem in the extension or the flexion. The first point will be LI15 and the second point will be extra 12. I will show you EX12. LI15 is the very well-known point. This is the point of anterior shoulder. LI15 एक बहुत ही बेहतरीन point है. So as at the location of anterior shoulder, we are having the location of LI50. This is a very good point to improve the flexion as well as the extension. Right? We can feel the bone here and the front margin, front border, anterior border of this humerus bone. That is LI50. We can feel the bone here. ये हमारे बोन के कॉर्नर पर होता है, एंटीरियर कॉर्नर होता है. You can see in this image. Look at it in my hand. मेरे हाथ में देखिए. So this is the location of, and we can see the shoulder here. The anterior part of the shoulder. If we do the up and down, we will feel the depression here. यहाँ पर हमें depression मिलेगा. So that is the location of LI15. This is the point number 1 that we have to stimulate the LI15. Just needling is not enough. You have to do little release. You release by a thumb or you release using a finger point at least for 1 minute. Then you put the needle, right? So when we are doing the stimulation of the LI15, it's releasing multiple muscle group. The second point and the most effective point, that is EX12. I will show you the location because EX12 is one of the great points. And we'll definitely find we will be looking the pain, हमें pain दिखेगा ही. So here we can see the spine. हम यहाँ पर रीढ़ की हड्डी को देख सकते हैं, right? So look at here. So this is the C1, C2, C3, C4, cervical 4, cervical 5, cervical 6, and the cervical 7. So these are the 7 cervical vertebrae. As soon as the cervical vertebra is completing, हमारी जैसे सर्वाइकल वर्टिब्रा की समाप्ति होती है, फिर थोरेसिक वर्टिब्रा स्टार्ट हो जाती है. So we can see the starting of thoracic vertebra, thoracic 1 and thoracic 2. Our target is thoracic 2. If the person is having shoulder pain, this pain is having connection with the thoracic 2. अगर किसी व्यक्ति को कंधों में दर्द होता है, उसको यहाँ पर लंप मिल सकता है thoracic 2 के बगल में. You need to release this blockage, this barrier, this lump. So from the vertebra, we are going half turn right and the half turn left. That is called extra 12 point, EX12. हमें यहाँ पर इस लंब को रिलीज करना होगा। किसी भी कंधे वाले व्यक्ति के इस भाग पर दर्द अवश्य मिलेगा। आप देख सकते हैं जिस भी व्यक्ति को कंधे में दर्द है उसके थोरेसिक 2 के नीचे आपको दर्द मिलेगा ही मिलेगा, दर्द उसके बगल में। तो आपको इस लंब को इसको पिघलाना होगा। Like I will show you in the other image. I am showing another point, not the EX12, but that point will be helping us to look at this point. Look at in this image. So from the thoracic 2, if we are going 1.5 to right, 1.5 to left, that is the location of bladder 12. Our target is not the bladder 12. हम thoracic 2 से अगर हम 1.5 चुन उधर और 1.5 चुन इधर जाते हैं तो हमें bladder 12 मिलता है। bladder 12 हमारा लक्ष्य नहीं है, हमारा लक्ष्य उसके अंदर का है। Let's see now. So in this image, we can see look at here. So here is the thoracic 2 vertebra. उसके नीचे वाले गैप से अगर आप 1.5 चुनाते हैं तो आपको मिलेगा bladder 12. But if you are going just half chun, just a half chun, that will be the location of EX12. That is the painful point when the person is suffering with the shoulder. That is called the motor point of the shoulder. That is a very effective point and will release the muscles from here. यहाँ की जैसी मसल को हम रिलीज करेंगे इसका प्रभाव कंधे पर दिखेगा। So look at here now. So we are going here. This is the trapezius muscle. We can see the trapezius muscle is going till the shoulder. Can you see this? How the trapezius muscle is supplying the shoulder. With the help of this point, we can release the trapezius muscle. So shoulder pain can be improved by the muscle, by this point. Now below the trapezius muscle, there is another muscle that is rhomboides. Okay, whatever the name, rhomboides. This is a very small muscle, right? Rhomboides. Our target is trapezius. तो हमने क्या किया, हमने नापा, हमने गर्दन यहाँ खत्म हो गई, जहां गर्दन खत्म हो गई वहां से स्टार्ट हुआ thoracic 1 और फिर thoracic 2. अगर आपको समझ में नहीं आया कि भाई कहाँ है, अरे समझ में नहीं आ रहा कि thoracic 1 कहाँ है, thoracic 2 कहाँ है, कई लोग हैं जिनको थोड़ा एनाटॉमी की नॉलेज कम है, तो कैसे जानेंगे? इट्स वेरी इजी. 4 finger. The length of neck is 4 finger. So keep your 4 finger below the bone of the head, where the occiput is ending. आपकी 4 उंगलियां रख दो जहां पर खोपड़ी खत्म होती है. Where the 4 finger is ending, that is the ending of neck, starting of thoracic spine, T1. जहां 4 उंगल खत्म हो गई वहीं से आपकी गर्दन की समाप्ति हो गई और थोरेसिक स्पाइन की स्टार्टिंग हो गई. T1 स्टार्ट हो गया. फिर देख लो एक T1 और इसके नीचे T2, T2 के नीचे हमारा आजू बाजू पॉइंट है. एंड पेशेंट विल शाउट, oh पेनिंग पेनिंग पेनिंग. यू आर प्रेसिंग द पॉइंट. आपने पेशेंट को बोला कुर्सी पे बैठ जाओ और आप पीछे से दबा रहे हो, समझ जाओ यू आर ऑन द राइट लोकेशन. This point release the trapezius muscles pain, shoulder pain. Even the person suffering with a headache. My favorite point, I keep on pressing to my patients. Patient बोलते इतना दर्द कहाँ से आ गया? Because patient is not complaining about this pain. Patient is complaining of the shoulder pain. But when we press it, how this much pain appear? Okay, then we are explaining because the energy block, energy is not able to pass from this because thoracic two vertebra, the nerve from the thoracic two vertebra coming to the shoulder, right? So we are pressing this point. This is got EX12. So 2 point LI15 and EX12. Will you able to do this? कितने लोग कर पाएंगे इसे? कठिन तो नहीं है, कर लेंगे. थोड़ा मसाज कर देना, ऑयल लगा देना और थोड़ा थोड़ा 2-3 मिनट तक उसकी आराम से मसाज कर देना और फिर पूछना कैसा लग रहा है. Initially patient will tell you, doctor, I was good for 6 hours or I was good for till the night. Then after I slept in the night, pain started again. Patient will tell you initially, no problem. Stimulate this point again with the 1 day break. Or after you also can put the cupping here. You can do the cupping here. Yeah, you do it today. You will see wonderful results. Excellent. The pain of the arm, even the person will tell, oh, my neck is free now. My shoulder is free now. Right? But this is starting. We might have to release more muscles because body is having too many muscles. We might have to release more muscles, but this point is very good and we can stimulate it. तो हमने देखा हमारी ट्रापेजियस मसल बड़ी गजब की है भाई, और बहुत लोगों को यही परेशान करती है. द ट्रापेजियस मसल इज बॉदरिंग. दिस इज मसल. We can see this is the trapezius muscle, right? You can see how it's covering entire cervical spine, and it's not only covering the cervical spine, it's going up. You can see here. Trapezius muscle touching your head. Okay. Then it's covering entire shoulder area. Then it's covering the entire length of the scapula. पूरे स्कैपुला की लेंथ को कवर करती है ट्रापेजियस. And we can release by this point. Got it? Now, so all this movement, whether the flexion of the arm or the extension of the arm or the rotation of the arm is external rotation. Even the abduction of the arm can be improved by these 2 points. अब हाथ को चाहे आगे से उठाना हो यानी फ्लेक्शन, हाथ को पीछे से खींच कर ले जाना हो एक्सटेंशन, हाथ को ऐसे रोटेट करके उठाना हो एक्सटर्नल रोटेशन, या हाथों को दूर ले जाना हो एबडक्शन, सभी में ये 2 बिंदुओं की मदद से आपको मदद मिलेगी. We already know the location of LI15. Let's move to the next. Little finger. Little finger. हम लिटिल फिंगर की बात कर रहे हैं. Many times there is a problem with the flexion. ये उंगली कड़ी हो जाती है, कड़क हो जाती है. ओके, अभी ये तो हम स्मॉल फिंगर की बात कर रहे हैं, एक एक फिंगर की बात की जाएगी. पहले मैं फिंगर के बारे में एक बात बता दूंगा. We are having multiple joint in the finger, right? So these are 5 bones. Okay. Bone number 1 means first metacarpal bone. Carpal means हथेली और कलाई की हड्डियां. So first metacarpal bone, second metacarpal bone, third metacarpal bone, fourth metacarpal bone, fifth metacarpal bone. We can feel this. These are the metacarpal. Okay. And these are called phalanges. इनको बोलते हैं phalanges 1, phalanges 2, phalanges 3. Or we already told you, toward the body means proximal phalanges. Away from the body means distal phalanges. So proximal phalanges, middle phalanges, distal phalange. Proximal means near the body. So proximal phalanges, middle phalanges, distal phalanges. Proximal phalanges, middle phalanges, distal phalanges. Proximal phalanges, proximal means toward the body. Middle phalanges, distal phalanges. Proximal phalanges, distal phalanges. Middle phalanges is not there. है किसी के अंगूठे में 3 phalanges हैं क्या? नहीं है, 2 ही हैं. In the thumb we have only 2 phalanges. Got it? श्वेता जी हैं क्या आपके पास? 3 हैं. हाँ? होते हैं किसी के पास. हाँ, थोड़ा थोड़ा छोटा सा होता है, इसलिए I'm asking you. But still we'll count 2 only into him. Okay. So there's a proximal phalange, there's a distal phalange. Now, what is the name of this bone? Metacarpal. What is the name of this bone? Phalangeal. Okay. So this joint is called MCP joint. Remember, MCP, metacarpo means M. M metacarpo means M. Means metacarpo MC. P means phalanges. Metacarpo means MC. P means phalange. MCP joint, MCP joint, MCP joint, MCP joint, MCP joint, MCP joint. तो हम शॉर्ट में आगे चल के कभी है कहां प्रॉब्लम है आप बोलोगे एमसीपी जॉइंट कहां पर है प्रॉब्लम एमसी एमसीपी मींस लोअर वन वेयर मेटाकार्पल meeting with the phalange, that is called MCP joint. So this is the flexion of the MCP joint. See, flexion of the MCP joint. Got it? And this is the extension of the MCP joint. Okay, so this is the MCP joint. Many person are having problem in the flexion and extension. और जो भी प्रॉब्लम है पहले पता तो होना चाहिए कि MCP joint कौन सा है. Okay. Then I will show you in the image. Physiotherapists already know this, but other person might be not knowing. ये देखिए. I will show you one image. It's a wonderful image. You can see this. You will able to understand quickly everything. So look at this image. So the first joint is called MCP. It's written MCP joint. Means metacarpophalangeal joint. Okay, so in the thumb also we have, everywhere we have this. Now second joint is called PIP. Third joint is called DIP. P means phalanges. Always. P means phalange. So what is PIP? So P means, now we have 2 more joints. We have 2 more joints, right? Can you tell me out of these 2 joints, who is proximal, who is distal? इन दोनों joint में proximal कौन सा है और distal कौन सा है? ये number 1 वाला proximal है कि number 2 वाला proximal है? Tell me, out of these 2 joints, number 1 is proximal or number 2 is proximal? Tell. अगर मैंने आपसे पूछा बताओ इन दोनों में proximal कौन सा है? Proximal कौन सा है? ये है ना. So this is called proximal joint and this is called distal joint. That's it. So proximal joint, the proximal interphalangeal, because 2 phalanges के बीच में, distal interphalangeal. PIP, proximal interphalangeal joint, distal interphalangeal joint. Got it? So let's write on. So we can see here PIP. PIP means proximal interphalangeal joint. And DIP means distal interphalangeal joint. Got it? तो तीनों जॉइंट का पता होना चाहिए, MCP joint, PIP joint, DIP joint. Now, do you think, because you are a acupuncturist, suppose you are a acupuncturist, do you think that you shouldn't know this? आपको नहीं पता होना चाहिए क्या? फिजियोथेरेपिस्ट को सब पता होना चाहिए, but as an acupuncturist we shouldn't do anything. That point is enough. Okay, what is the problem? Frozen shoulder. Okay, अंदर क्या है वो नहीं पता, अंदर क्या है वो नहीं पता. Suddenly one orthopedic doctor will call you, doctor, one patient is having the problem in the MCP joint, and doctor will call you definitely. Can you do something? Sir, what is MCP? Okay, it shouldn't happen, never happen. You should know each and everything, all the ligaments, all the tendons, all the joints, everything. What is the rheumatoid arthritis? What is happening in the joint? वो क्या रहा अंदर? What is gout in the uric acid? What is happening inside? Joint की प्रॉब्लम है तो सबको पता है, वो तो लेमैन को पता है, वो तो एक. But as a healer, we should know what is uric gout, what is happening here, what is rheumatoid arthritis, what's happening inside the joints. Okay. So now we have understood MCP joint, PIP joint, DIP joint, three joints. Okay, now the person is having problem in the small finger. The person is not able to flex the finger. अपने फिंगर को फ्लेक्स नहीं कर पाता. So look at this point. Who will be helping to flex it? We'll put the SI3 point. SI3 point will be here. And will able to flex the small finger. This is the location of SI3. कई बार उंगलियां कड़क हो जाती है, स्ट्रेट हो जाती है, बेंड नहीं होती. Many persons facing this problem, they are not able to bend the finger. Then this is the point, SI3 point. Who will normalize the muscle and nerve and the motor nerve so that you can flex the finger. So this is the location of SI3. We can put the point here, right? कभी आपको स्मॉल फिंगर को एक्सटेंड करना हो, मान लो किसी की पहले से मुड़ी पड़ी है, तो ये काम नहीं करेगा, ऐसा होगा. Some patient is coming to you, a small finger is already bent. Then what we can do with SI3? No. SI3 will responsible for bending, flexing. Some patient is already having a spasm like this. Okay, now you want to open it. Then SI3 will not help, because SI3 is the point responsible for a spasm, responsible for flexion, not the extension. Extension will happen why some other point, we'll see. Okay, so enough for today. आज के लिए इतना काफी है. अब हम कल मिलेंगे इसी टाइम में. Thank you so much. See you tomorrow. Bye bye.